You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. According to my first guest, no more dentures. She says you can get a permanent set of teeth in just a few appointments. My guest is Dr. Anna Smith. Dr. Smith, welcome to the program.
Thanks, Randy.
Now, we've had you on the program before,
Yes.
Talking about a variety of topics. Today, it's dental implants. So before we go there, for people that don't know you, tell us a little bit about your practice. I mean, who's the typical patient, and what are the different procedures you do?
Sure. My practice is a general dentistry practice, so we see little kids, ages 3, 4, and 5, coming in for their cleanings, and then we see the teenagers who are getting their braces, and then, of course, moms and dads doing the regular things like fillings and extractions and implants and root canals. And then as we get older, then there are more implants, dentures, partials, things like that. I even see patients who don't come to me for dentistry at all. I see them for sleep apnea, and we help them get rid of their CPAP machine. So we really do everything in dentistry. And one thing that's unique about my practice is I try to be as conservative and help people save as much time as possible. So when you come to my office, we try to do everything that we can in one appointment. We try to keep it as simple as possible and do things as quickly as possible and still give you a great job.
So at the top of the show, I said no more dentures. Get a permanent set of teeth and possibly just a few appointments. Do you believe that? That's the future of dentistry, no more dentures?
Right, I think that's where we're going. And it's even happening right now. Patients will come in, they have dentures, they don't like them, and with just 2 or 4, sometimes 6 implants, we can get them new teeth. We just put these teeth in and they permanently stay there. They don't come out like a denture.
So dental implants and then like a denture goes over it.
Yeah, and it just stays in place. It's screwed into place, it doesn't come out.
Is that right?
Yeah.
So what are the different categories of dental implant patients that you see?
We see patients who are just missing 1 or 2 or 3 teeth. They just need to have a single tooth replaced or a couple of teeth. That's very common.
All right.
We also see patients who have dentures and they don't like them. And so they're looking for something. They're looking for something to help hold their dentures down and into place. Now, their denture may still come off. It may still come out at night. They just wear it during the day. But that's another type of dental implant patient. The third patient is the one you just mentioned, the patient who either has a lot of teeth and they know they need dentures, but they don't want to get them because they know all the bad things that come along with that. They're not ready for that, so they're holding off. Or the patients who have the dentures and they don't like their dentures. They want to get something permanent that doesn't ever come out.
So how many people, let's say in St. Louis, and that's a big place, tens of thousands of
Sure.
upper or lower denture wearers?
Yeah, definitely. Dentures are very, very common. Dentures, partials, all those things are very common. And a lot of people have them. The problem is they don't like them, but they're not people that typically go to the dentist. They don't know their options.
The denture wearers don't go to the dentist.
Right.
Good point.
They don't have teeth. They just have dentures. And they probably lost their teeth because they didn't have a good experience at the dentist. They didn't go all the time to get their teeth cleaned and stay on track like that. And so these are people that don't know their options because they're not in the right environment to learn them. And things have changed so much in the last few years.
So are you of the opinion that of the tens of thousands, 100,000 people, St. Louis or around the area, that they would all do it if they knew the benefits of dental implants?
Sure. Yeah, why wouldn't you? Why would you want your teeth to come out? Why would you want to deal with the adhesives that you have to use? Why would you want to deal? I have a patient who came to me because he was at Walmart and he sneezed and his denture fell out of his mouth. And he was so embarrassed. Here it goes flying across the floor. He was so embarrassed by that he came on Monday morning to learn his options. He had to do something that was too embarrassing. So this affects people. They don't want to have false teeth. People don't want to have dentures or partials, but they don't really know what to do.
Now, you were mentioning that off camera that you just went to another course about just with as little as 4 dental implants, giving a full arch of teeth. Elaborate. Tell me about that.
Sure. We used to think that you had to have 6 or 8, or sometimes we used to even think you had to have 1 implant for every tooth that was missing. That's not the case anymore. That's really this technique has really brought the cost down and made the whole process easier for everybody involved because we can just place 4 dental implants on the bottom or sometimes on the top too, and then in many cases the same day put permanent teeth on top so that you don't have to have that denture come in and out anymore in just one appointment.
What about pain though? It seems very painful.
Lots of people think that. And I honestly was surprised when I started placing implants 8 years ago. I was very surprised when patients would come back and say, that wasn't a big deal. And patients are I think we assume that it's going to hurt whenever we place an implant, but with our lasers that we use today and our very conservative techniques, really the gums are what feel things. The gums are what become sore. And when we place an implant, it goes into the jaw bone. There really are very few nerves and things that feel in the jaw bone, so it's much more comfortable. Most patients will say that was kind of like having a filling. It's not.
So pain
what
is not
expect.
something they really complain about.
It's really not.
Okay, so a denture wearer comes in, or a person missing teeth comes in. What do they ask on the consult? Like, what are the frequently asked questions that they want to know about?
Most of the time they want to know how long it's going to take, because they've been told that, oh, this takes a long time, maybe up to a year, and they're usually excited to learn that it doesn't. We can get this done quickly. Most of the time people are concerned that they're not going to be a candidate, that it's not going to work for them. So we frequently hear, is this going to work for me? How do you know? What are the statistics? Dental implants are incredibly successful. And in my practice with my patients, I have 98% success rate with the implants that I've placed. And
that means what? They don't fall out?
That means they stay in place and they're able to hold the tooth on top, or the denture, or whatever it is that we put on top. They're incredibly successful. And so that's always something that patients are concerned about. They want to know that if they're going to invest their time and their money with me, that it's going to work. And for the most part, it's very successful. A lot of patients come in without hope. They really want to know, is there hope for me? Is there hope that I don't have to use these adhesives anymore, that I'm going to be able to get away from my teeth falling out? Lots of people, they've spent their life enjoying food, and then they get dentures and they can't taste their food anymore because the denture covers the roof of their mouth. They can't taste. Or if they drink wine, you have to be able to feel that on the roof of your mouth and use all your taste buds. They can't do that anymore. So they really are looking for hope that there's something better.
What are the age ranges of patients, the denture wearers that are out there? What are those age ranges?
There are people 100 years old now who can get implants. 100
years old?
There are those people out there. And we used to think, oh no, you shouldn't go over 55, 60 whenever you get implants. That's completely changed now. That's not the case. So there are patients who are getting implants over 100 years old.
Why would they want to do that at 100 years old?
Because they want to enjoy their life. They've earned it. And so they want to be able to eat. They don't want to deal with adhesives. They don't want to deal with all that stuff. They just want to live and enjoy their food and smile and not have to think about their teeth.
So a denture wearer goes in. If everything works out right, okay, they go in. What is the ideal time frame if everything works out? From somebody watching this, they go in, it's the consult, you get the imaging, you do all of those things. How soon? What's the turnaround time potentially to get a whole full arch of teeth?
Sure. After that consult, and we gather all the information that we need, then we'll schedule one day for this patient to come in. It'll be a full day. We'll be there for 6-8 hours, and we'll place the implants. In many cases, then we can actually place their permanent teeth on top of those implants, and they leave with their permanent teeth that day. Other patients, it just depends on the patient and what they want to do. Other people, they don't really want that much. They just want to make sure that their denture is more stable. So they're happy with their denture. And in some cases, I can even use the denture that they have, the one that's existing, place some implants underneath of it and give their denture something to grab onto so that it stays in place better for them. So every situation is different. Now, a lot of times those people that come in with their existing denture, what they learn after I talk with them, what they decide is, if they're going to do it, they really want a new smile. It's not so much about the teeth.
Okay.
They want a new youthful smile. They want a new set of dentures too. And we'll talk through what they want different and how they want to look and what they're going for to design them a new smile. Because as much as this is about getting away from adhesive and being able to chew and enjoy your food, a lot of it is just having a great smile. People with dentures typically don't smile too much because they feel like it's fake, or they feel like it's not a good representation of who they are. Dentures don't have to look bad anymore. We can make teeth, whether they're dentures or permanent teeth, look good. You can look youthful again with new teeth.
So they can eat whatever they want. I mean, how soon can they eat? Also.
Yes, for some people it's right away. Now for some people, if we're taking all their existing teeth out that day and then putting these in, of course you're going to have to heal. It's going to be a few weeks before you're up and back running. But for most people, they can eat something right away.
And they're strong.
Yeah.
So you can chew, you can eat.
Right.
Steak.
Yes.
Apples, broccoli, whatever.
Absolutely. All those things that denture wearers just shy away from. They've learned not to. Denture wearers are incredibly resilient. they just, they kind of chew their food. If you watch a denture, I've done this in restaurants. I can pick out people who have dentures.
This is what you're doing in the restaurant. Because you're a dentist, you can't help it.
I know, okay. It's a problem. Because you'll watch them, it takes them forever to eat. They're chewing and chewing and chewing and chewing. And sometimes they even develop jaw problems because it takes them so long to
So they're
eat.
not really tearing the food
No.
if you're wearing a denture. They're
Right.
kind of rubbing it together.
They're just rubbing it between, giving their saliva time to break it down. It's different than people who have teeth that actually chew and break up that food.
So let's talk about options then for denture wears.
Okay.
What are other options?
For denture wears, we can sometimes take an existing denture and we can put some implants underneath of it. This is an example where this is a denture, and then underneath we place just 2 implants. We can make it even more stable by placing 4 implants underneath. And then the denture just has some little holes in there where the denture snaps on to
Let's
the
take a look
implant,
at this.
and it's more stable that way.
Okay, so this is a lower.
It is.
Okay. 2 implants, lower jaw.
Yeah.
Is that right? Do I have this right? And then this, hope we could see this. So it's little snaps and just snaps right on.
Right.
That's 2. So 2 implants. Now, we talked in my green room about
Yes.
if there was a Friday free try-in period for all the denture wearers. Tell that story.
If on Friday we could give every denture wearer just 2 implants to fit underneath their denture, no one would be able to use their denture without implants on Monday. You just get used to what you have. This is so much better than using a denture without implants. And you don't have to use adhesives anymore. It's going to stay in place. It's not going to fall out when you sneeze. You're going to be able to keep your denture down when you chew so that you don't have to work so long.
I know
so
denture
hard.
wearers. Are you saying that they're all, for the most part, kind of miserable? Or they're not happy?
Right.
Because I never hear complaints with denture wearers.
They don't talk about it. Who wants to talk about the fact that they have a denture? People don't talk about that.
Okay, so they tell you, obviously.
Yeah, they come to me and complain about how much they hate their denture. But most people who have a denture, especially a lower denture, those are the harder ones. Most people who have them have issues. Now, some people adjust to it. They get used to it. Some people adjust to anything. And there are people who do okay with dentures. But if you can have implants under your dentures, it's so much easier to do everything you have to do.
But what about somebody 74 years old, like my mother? Okay, so when she's older now, but when she first told me this, she said, I can't get dental implants. My medical doctor told me I couldn't get dental implants because I'm too old. They'll fall out.
Right.
You say that's not
It's what we
too old.
It's true. It's what we used to think. We used to think that implants shouldn't be done over the age of 55, 60. That was kind of the break-off point. There really is no limit to how old
But
you
the
can
bone
be.
will grab onto it?
It will.
Even at
Yeah.
80, 90?
Well, think about how people in their 80s, 90s, they're having hip replacements and knee surgeries, and they're having joint problems and joint replacements and bone surgeries. The same thing with your jawbone. It's a type of bone. We're just placing a titanium pin, an implant in that, and it heals, just like any other area of your body.
So the denture wearers that are watching this, they're going to be very skeptical, okay? So they're worried about pain,
Right.
and you're saying it's not very painful.
Yeah, to have implants really isn't.
Because the bone, you say, has no...
Right. And what is painful, what can be sensitive, is the gum tissue. So when we place implants, we're very conservative with what we do with the gums. And in most cases, I can use a laser to help the gums heal faster. It also will keep them sterile so that they're less prone to infection. It just helps. The laser is great to go along with implants to help everything heal faster and work better.
Okay, so the denture wearer on day one, what does that consult sound like? Okay, so they're there, they want to know about pain, they want to know, are they too old? What else?
Most of the time they want to know about cost. Lots of times people think that implants are just going to be too expensive, too pricey.
Because insurance does not cover this. I mean, the whole procedure.
Usually not. There's always something left over
And
for the
Medicare
patient.
definitely doesn't cover this.
No, not at all. So there's always something left over for the patient to take care of on their own. So that's something we'll go over too. And if we were, and lots of times people think it's going to be too pricey because they're assuming they're going to need 1 implant for every tooth. But remember, if you have a denture, we can just put 2 implants in underneath of a denture. That does not cost much at all. That probably costs less than what you paid for your dentures to put underneath.
So, right, so
those
2
denture in
implants
place.
securely snap in, snap out. With
Right.
those, could you eat an apple or broccoli?
Yes, much easier than you're doing now.
Okay, and they won't, I guess, fly out.
No, they're going
Could
to
they
be
be
stable.
made so tight where you couldn't even pull them out with your hands? Have they ever? Can they complain about that?
Yeah, if you want to have it tighter, then I would recommend more implants. So instead of 2, let's do 4 on the bottom. That's going to make it a whole lot more stable so that you can chew a whole lot easier that way.
Now you finance this.
Yes.
Because in this economy, a lot of people are having, it's tight. In fact, I think in some of your advertisements that you can finance anybody.
Right.
If you want to.
We do offer financing for everybody, and we'll go over all of that at the consult. And so I'm not just going to place implants in you and then we're going to figure out how you're going to pay for it. That's not
right.
how it works.
Well, obviously, but you do offer financing.
Yeah.
You'll carry the financing
Yeah.
for a patient. And what about consults? Is there a fee for the consult?
No, the consults are free.
So for the upper, so for lower, you say is a little bit, it's 4 for a fixed set of teeth, a full arch. What about upper?
Yeah, with upper dentures, we typically start with 4. We can go up to 6 or even 8 if need be. But the great thing about the upper is that when you have a denture, it has to cover the roof of your mouth. And that's one very common complaint the denture wearers have about the denture is that it covers the roof of their mouth. Food gets stuck underneath of it. They can't taste as well as they could. They can't taste wine. They can't taste really any food whenever they eat because you need the roof of your mouth to be able to enjoy that food. So, for example, if we were to place 4 or 6 implants on the roof of your mouth, this is a lower denture, but kind of gives you an idea, we can actually take the roof of your mouth, take that part away from the denture and make it more like a horseshoe shape. And so you can feel the roof of your mouth again whenever you get implants underneath your dentures. And it'll sit on there like this where there's nothing on the roof of your mouth.
Now the appearance, because I always, and we've talked, I feel like I could spot dentures walking down the street.
Right.
So they can look good.
Yeah.
They can look like cosmetic dentistry.
Right. The ones you spot are the ones that don't look good. So those are the ones you're seeing. You're not noticing the ones that actually look natural. There are people who have dentures and they look great. They look like their natural teeth. And lots of times I really believe this, that people put off getting dentures so long. They know they need to. They have infection. Their teeth hurt. They only have a few teeth left. They can't chew with what they have. They're embarrassed to smile. Those people put off getting dentures because they're afraid they're going to look bad. They're afraid they're going to look fake. We can make dentures today that don't look fake for you. And so we work with what you naturally have. We'll work with your natural smile line, with your lips, with your mouth, the shape of your mouth, to make sure your teeth fit. The teeth that we give you need to fit into your mouth and look like your natural teeth.
What if somebody has bad gums? Could they still get dental implants? I mean, they have loose teeth,
right?
Infection or whatever it's called.
Yeah, definitely. Because whenever the source of the infection is the bad teeth. So when we take the bad teeth out, then the gums heal and the implants will go right in that area. And it's very common for patients who say, I have bad gums, I have gum disease. They've been told that they can't get dental implants, but that's not true with today's technology, with today's techniques. When we take the old teeth out, then the infection goes away and the implants are safe and secure.
Okay, so if somebody, though, is 75, which is young, and they've been in dentures for 25 years, I've been told that maybe they don't have enough bone.
Right.
So what about those people?
In most cases,
because you lose bone, is that right?
You do. Whenever you lose your teeth, then your bone starts to disintegrate. And there's really nothing you can do to get that bone back except to get dental implants. When we place dental implants into your jawbone, you don't lose the bone anymore. Your jaw now has a job. It has a reason, and it will stay in the position.
But if you've been in dentures for 25 years, do you have enough bone to do this? Most
people still do. And what we used to do, we actually would do some grafting procedures, help to build the bone back up. What we're finding is that most people now have enough bone for us to place the new technology implants into so that they don't lose any more bone and the dentures, the teeth will still stay on top.
Okay, so we have some animation of this procedure. Let's go to the clip. So what are we looking at here?
So on this, it shows how the 4 implants are being placed, and then we put some little caps over the top of them, and then the denture just snaps right down onto that. And I believe in this animation, it actually shows that the teeth are being screwed on. So this is the type of patient who's not going to have dentures anymore. These are permanent teeth being placed onto these implants.
Looks very simple.
Yeah.
It is that simple.
It really is that simple. That can be done in one day.
So do you think, by the way, okay, so no more dentures, that the denture wearers, if they knew this was possible, because you say they don't go to the dentist anymore.
Right.
Do you think they'd be lined up to do this?
Absolutely.
If they knew what you know?
Yeah, who wouldn't? Most people are just resigned to the fact that they have dentures. They think that's the end of the road. They think that they've had their chance with their teeth, it went bad, now they have dentures, and that's all that they can have. But it's not true anymore. There's something better. You can have teeth again. You don't have to go without, whether it's with your dentures or it's a new set that goes over the implants.
Now what about losing a tooth in the front?
Yeah.
Okay. Can you match it up? And what's the advantage of doing that over traditional dentistry? Help me understand that.
What we would traditionally do if you were just missing one tooth, especially in the front, is we would place a dental bridge. Now, what a dental bridge does is it has to connect to the teeth on either side. We have to cut those teeth down to get the bridge to stay on. Most bridges have to be replaced in about 10 to 15 years. And so it's just a continuous thing you have to deal with for the rest of your life. With implants, we just place one implant to replace one tooth. It's not connected to anything else. So if you have an issue with another tooth, it's not connected to your implant. We're just working on that one tooth. The other great thing about the implants is that they preserve your bone. If you get a dental bridge, and you may have noticed people like this, you can tell it's a bridge because their gums are up higher. You can see a black space underneath of that bridge.
Yeah, I think I've seen that.
Yeah, you don't do that with the dental implants because it preserves the bone. The bone stays healthy. The gums stay in place. They don't recede up. They don't wither away. And so when you smile, even with the front tooth, if you have an implant on your front tooth, in most cases you cannot tell that it's an implant. It just looks like a perfect tooth.
So it is like getting your tooth back.
It is. It's the very closest thing we have to getting your actual natural tooth back. And in most cases, it lasts a lifetime. In most cases, unlike the bridge, you don't have to go in and replace that later.
Now, you say a lot of people hold on to their teeth too long. We talked on the pre-production meeting on the telephone that people are out there, their teeth are like hanging on.
Yeah.
They need to go.
They do. They just don't want to.
What do you say to them?
They're scared. They don't know what to do. So with them, we can give you a new smile. We can give you healthy teeth. You don't have to deal with those teeth that hurt, with the gums that are infected. You don't have to deal with all the problems that come along with the bad teeth.
So people wait too long, especially men, right?
Yeah.
Until they can't eat
They
anymore.
will.
Nobody wants to go to the dentist, right?
Right. I've had patients come in to see me. They only have 2 teeth on the bottom left. And they may be right to they can't chew. They have nothing to chew with. I've seen everything, I promise. Nothing is different. Well, when patients come in, really in that case, they feel hopeless. They don't know. They feel like
they don't smile at all.
Oh no, how can they smile? They don't have anything to smile with. And most of the time, another thing that happens is when people wait too long, it starts to age them. They start to realize that their face starts to sink in. If you don't have teeth to smile with, eat with, your face starts to sink in. You start to look older. So these people who have waited too long, they finally come in to talk to me, and we realize that we can fix this. We can help them. And just to give somebody teeth, to give them dentures, whatever type of teeth they decide to get, they can smile again. They look younger. People look 20 years younger.
How important is this smile, by the way?
The smile is everything. The smile is how you portray yourself to the world. It's how you relate to the world. In fact, the American Academy of Cosmetic Dentistry did a survey, and they asked just general people, not dentists like me, but just general people, if they had ever used someone's smile to evaluate their education level or their economic status. And 75% of people said yes, that they do.
Good point.
Yeah, the smile is everything. And it goes beyond that, is that it's not only is it how you portray yourself to the world, it's how the world sees you. If you see somebody with 2 teeth left down here, just like that survey said, you're going to think they're not so smart.
Fair enough.
Yeah. And so it creates, it's a cycle that creates a self-image issue. And that actually, in fact, impacts your personality. And so these people typically are pretty quiet. They don't want to draw attention to themselves. It's taken everything they can muster to come to the office and talk to a dentist about their teeth. And I understand that. And so these people, I understand, they have used all the courage they have to come talk to me about that. And they're so hopeful when I let them know that there's something we can do. We can help them, and it's not embarrassing. And then they start the cycle. They start reversing the cycle. Instead of having a poor self-image, now we're on the cycle to have a good self-image so that they can relate to people.
Is this one of those things that they would say, I wish I would have done this years ago?
Oh yeah, all the time. Nobody wants to have 2 or 3 teeth left. Nobody wants to be in pain like that. But the fear, not knowing what can happen,
it does seem painful, though.
Back.
You're saying pain is not something they complain about.
No, with dental implants, and I'm telling you, I was probably the biggest critic on this. I would call my patients after I placed the implants and call them that night and say, oh, how are you feeling? Are you doing okay? Do you need some medicine? And most of the time, patients would say, no, I'm doing great. And it surprised even me at the beginning. But that's typical. That's common now. And patients will typically say, having the root canal done on the tooth, that will cause more sensitivity than having this implant placed.
So no more dentures. Okay, so denture wears, by the time they become denture wears, like you pointed out early on, which is a very good point, that they went through a lot.
Yeah.
From hot and cold sensitivity to sore, bleeding gums or bad breath or whatever.
Right.
I guess the last thing they want to do now is to go to another dentist.
Right. Yeah.
So what do you say to them?
They consider me
They're going, look, I already went through that. I was glad to get my teeth out
Yeah.
because they're not in pain anymore. what do you say to them?
They're considering
just highly
me the
anxious.
enemy. Right. They don't know what is possible. So I tell them that we can help them. We can, all the bad things are gone. Now we're going to start working on the good things. So now we're going to give them the smile that they want. Now we're going to give them the teeth that stay in place. They've gone through the natural process. Now we're going to start the better process, the dental implants and the teeth that stay in place and the smile that they wanted, not the smile that they were born with. And so it can get better. It doesn't have to get worse.
So you offer oral sedation?
Yes.
So what do they're just relaxed during the procedure?
They're extremely relaxed during the procedure. And what we do is we'll give them a little medicine to take before the night before they come in, and then I'll give them some more whenever they come to the office. And for most patients, they're not asleep, but they're so relaxed. It's like those first few minutes right before you fall asleep when you're just really relaxed. That's how you feel. And then throughout the procedure, I'm always checking, we're always monitoring to make sure they're comfortable, everything is fine. Most patients, when they're sedated with oral sedation, it almost has an amnesia effect. They won't really remember how long they were there. They won't remember the details. Yeah, they'll remember little tidbits. They'll know they got their work done, that they were at the dentist.
But during the procedure, they don't feel it.
No,
so
they're
pain is
completely
not an
comfortable.
issue there.
No, not at all.
And very little cutting to the gums?
Very little. Because of our laser, we typically rarely have to use scalpels anymore. And so we can use our laser.
And not everybody's doing it this way.
That's true.
Is that correct?
That's true. Yeah, our laser is a great piece of technology that we've implemented in our practice over the last few years. And it decreases infection, so things typically heal faster. They work better that way. And you just have less sensitivity than you would if we were using older technology.
So we're out of time. Final message, somebody to the denture wearer, or I guess if they're missing any teeth, what do you say to them?
Come in for a consultation. We can help you. Whatever it is that you don't like about your teeth, it can be changed. Whether you don't have any teeth, you need some, or if you just don't like the way your dentures fit, you're sick of the adhesives and not being able to taste your food anymore and not being able to chew your food anymore, we can help you.
Well, thanks for coming in. Great information. They can visit your
Randy.
website, look at some of the information there, find out more. Consultations are free.
They are.
You offer financing.
Yes.
You have traditional financing. So if they're turned down, you may finance them yourself.
Right. We have some in-house financing options, and we'll go over all that at their consultation.
And insurance doesn't really cover this, we should mention.
Right.
The
Usually
whole
it
thing.
doesn't.
And Medicare does not.
No.
But you'll work something out.
Right.
Is that right? Okay, thanks again. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com and just put in St. Louis Dental Implants, or you can put in Dr. Anna Smith. You'll find her there. And if you're on Twitter and would like to comment about this, you can put hashtag The Wellness Hour. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.